over the next few decades. And what they did was to look at who died, who developed cardiovascular disease, and what the risk factors were. And they've started several other generational studies. So there was an offspring study started in 1972, and a third generation study started fairly recently. And it's this sort of data that have led us to understand what the risk factors might be. Most of it is driven by age, and that's a problem, and I'll tell you why in a little while. Cholesterol and HDL cholesterol ratio, which I've mentioned, blood pressure, smoking status, gender, because of course in general in the UK population, males suffer cardiovascular disease more than women. That's not true in every country as it happens. A measure of how hard the heart is working, so left ventricular hypertrophy, which can be measured using ECGs to be technical, and type 2 diabetes. So that study identified all those risk factors as being important. And I'm not going to go through this, but that was the outcome from that study, looking at the formula, is rather complex mathematics, relating those factors to the risk of cardiovascular disease. Simpler, and I'll try and explain to you what this means here. We have a reference group here with different levels of blood pressure. And what's happening here as we go down further and further, more and more risk factors are loaded on. So at the end, you've got an individual who is 60 years of age or greater with diabetes, who's male, who's got a low HDL, who's a smoker, who's got a high cholesterol and a high blood pressure, systolic blood pressure of 180. And that individual, not surprisingly, has a pretty high risk of developing